Hey everyone, and welcome. Today we are going to take a really integrated look at health. We're going to connect the dots between that calming herbal tea you might be sipping on, the vitamin you take every day, and even those prescription eye drops from your doctor. It's a journey that, honestly, might just change how you think about your own well-being.
So just think about it for a second. You've probably got a cabinet with all of these things sitting right next to each other, right? But how do they actually work together? Or maybe the bigger question is, could they be working against each other? Well, we're about to find out. So first up, we're going to step a little bit outside the familiar territory of the doctor's office. We're going to explore some of the therapies that work alongside and sometimes even challenge what we think of as mainstream medicine.
And that brings us to a really crucial term, complementary medicine. Now the key word here, the one I want you to remember, is alongside. This is not about ditching your doctor's advice, not at all. It's about adding therapies that can work with it to create a much more holistic approach to your health.
And I bet you'll recognize some of these. We're talking about things like herbal medicine, the ancient wisdom in a cup of tea, or the really precise art of acupuncture, the incredible feeling of chiropractic care, and of course the soothing sense of aromatherapy. These are all really powerful tools in that complementary health toolkit.
Okay, so now let's zoom in on one of the oldest and most popular forms of complementary therapy out there, the incredible power of plants. Yeah, you guessed it, we're talking about herbal remedies.
I'm sure these names ring a bell, right? You've got Echinacea, which is kind of the go-to when you feel a cold coming on. Ginger, that wonderful soothing balm for an upset stomach. And ginkgo biloba, the ancient herb people use for a sharper mind. Every single one of them is a natural powerhouse with a super long history.
Okay, but here's a really crucial reality check. Just because something is natural doesn't automatically mean it's harmless. Herbal remedies are potent, and they can have some seriously powerful interactions with your prescription meds. This is a conversation you absolutely 100% need to have with your doctor.
All right, so let's shift gears a little. We're moving from the plant kingdom to the actual building blocks of our own bodies, vitamins. And when it comes to vitamins, there is one word that is king: balance.
You can think of your body like a finely tuned engine. If you give it too little fuel, it's just going to sputter. But if you give it too much, you're going to flood the engine. Vitamins are exactly the same. It is not about more is better. It is all about that Goldilocks principle, getting it just right.
Let's take vitamin A, for instance. We absolutely need it for healthy vision. But if you get too little, you could find yourself struggling with night blindness. But if you go way overboard, you could actually be looking at serious liver damage. See, it's a perfect example of that vitamin tightrope walk.
And what about good old vitamin C, the rock star of the immune system? We all know that not getting enough can lead to horrible things like scurvy. But here's the twist. Some research suggests that taking these megadoses might actually weaken your defenses against certain viruses. Whoa! It's just another reminder that with vitamins, balance really is everything.
And of course, the list just goes on and on. We've got vitamin D, the sunshine vitamin, vitamin K, which we get from our leafy greens, iron, that tireless courier carrying oxygen through our blood, and folate, basically the master architect of our DNA. Every single one is a tiny hero with a massive job to do. So now that we've kind of explored the bigger landscape of health, let's bring it all into sharp focus with a really specific and fascinating example, the super intricate world of eye health.
So in the world of conventional medicine, the approach is, well, it's surgical in its precision. If you have a cloudy lens from cataracts, a pretty simple surgery can restore clear vision. That dangerous pressure buildup from glaucoma, medicated drops like timolol can bring it down. And damage from macular degeneration, there are these highly targeted injections that can slow it right down.
You ever wonder how your doctor can be a bit of the detective? Well, when it comes to red, irritated eyes, a single, simple question can unlock a ton of diagnostic clues. And that question is it in one eye or is it in both? And here's the answer to that little mystery. If the redness is in both eyes, your doctor's probably thinking allergies, pollen, dust, all that fun stuff. But if it's just in one eye, well, that's a classic sign of an infection, like the dreaded pink eye. It's a simple observation, but it's got a really powerful diagnostic punch.
Okay, so from the world of sight, let's now turn to the world of sound. Let's explore how this whole integrated approach to health applies to the really delicate and complex stuff happening inside our ears.
And this story of targeted treatment, it just continues. That awful, throbbing pain of a middle ear infection, a round of antibiotics can usually knock it right out. That maddening, persistent ringing from tinnitus? There are strategies and tools to help manage it. And that itchy agony of swimmer's ear? A few antibiotic drops can bring some very sweet relief.
So the takeaway here is pretty simple. Precision matters a lot. Knowing exactly where the problem is it deep in the middle ear or just in the outer canal? That is the key to choosing the right weapon from the medical arsenal.
Okay, so we've journeyed all the way from the gentle power of herbs to the laser focus of modern medicine. So what's the golden thread that connects it all? What is the one, single, most important thing you should take away from all of this?
It really comes down to one simple, powerful idea: communication. That innocent-looking herbal tea you're drinking, it could be battling your glaucoma drops. That healthy new vitamin supplement you started, it might be undermining your other medications. The only way to build a truly integrated, effective, and, most importantly, safe health plan is to give your healthcare team the full picture. You've got to be your own best advocate. Tell them everything. Your health really does depend on it.